Here she is, a little over 7 pounds, with wispy brown hair, a healthy cry, and a hearty appetite. At birth, or in the event of a miscarriage or abortion, fetal blood cells may enter the mother's circulatory system when the placenta pulls free. Because the child's blood is different from her own, the mother's immune system may form antibodies against it, substances specifically designed to attack the Rh-positive blood cells. Now, suppose the woman becomes pregnant with another Rh-positive fetus. Her body is already primed to mobilize a large force of antibodies. These will travel through the placenta to the fetus and will break down fetal blood cells. This can result in anemia, brain damage, or even death for the fetus. Fortunately, a vaccine called Rh immune globulin can prevent Rh disease. It must be administered to an Rh negative woman within 72 hours after any miscarriage or abortion, or after birth of an Rh positive baby. This vaccine works quickly to destroy any fetal Rh positive cells in the bloodstream so that the mother never forms any antibodies that might damage the next fetus.
Baseline characteristics of the mother, such as age, physical condition, presence of chronic disease, history of previous pregnancies, family history, and blood type, are important in assessing her prospects for a successful pregnancy. But her health and her behavior during the actual time of pregnancy are also extremely influential. Let's look at one important aspect of prenatal care: the mother's diet. Throughout pregnancy, the mother's bloodstream brings to the fetus, by way of the placenta, nutrients and oxygen that are needed for growth. What the mother eats and how much she eats will largely determine what the fetus gets in the way of basic building materials. The average woman requires about 2,000 calories a day, but during pregnancy, an additional 300 to 500 calories are required. The need for specific nutrients, especially protein, vitamins, and minerals, also increases. To fill these needs, a pregnant woman must eat a varied, well-balanced diet. Her physician may prescribe a vitamin and mineral supplement as well. Although the importance of prenatal nutrition is well established, many people persist in mistaken notions on the subject. One of these, known as the perfect parasite theory, maintains that the fetus will draw its nutritional building blocks from the reserves in the mother's body, no matter what the mother eats during pregnancy. Some have taken this to mean that the mother can indulge her whims during pregnancy, gorging on rich treats and ignoring the basic foods without depriving the fetus. Others have concluded that the presence of the perfect parasite offers a perfect opportunity for the mother to lose weight, that if she eats sparingly while the fetus is consuming her stored calories, she may emerge from pregnancy leaner and trimmer than before. However, there is no evidence to support the idea of the perfect parasite. The fetus does enjoy priority access to some nutrients, but it receives many others only after the mother's needs are met. When the mother is poorly nourished, both mother and fetus are likely to suffer. Another nutritional fallacy is the idea of brain sparing. This holds that the brain is the last organ to suffer from inadequate nutrition, and that even if it is affected, its development will merely be slowed, not irretrievably damaged. This is a false and dangerous idea. Prenatal life is a time of rapid proliferation of brain cells. Without the proper fuel, brain cells grow and multiply more slowly. This can lead to a child's having a smaller brain with fewer cells, a brain that is not optimally developed.
Today, most doctors expect a woman to gain at least 20 pounds during pregnancy and encourage her to eat well and eat enough. This is considered important to ensure a sufficient supply of nutrients for mother and fetus. An adequate diet also helps to support the increase in the mother's blood volume. During pregnancy, the volume of a woman's blood increases by about 40% to serve the demands of the growing fetus and the flow of blood increases as well. Anything that interferes with blood flow to the fetus is potentially damaging. This is the case with cigarette smoking. The drug nicotine, absorbed during smoking, constricts blood vessels throughout the body, slowing delivery of nutrients and oxygen. The fetus's own circulatory system may be affected as well. In addition, carbon monoxide, also absorbed during smoking, actually reduces the amount of oxygen present in the blood. Heavy smoking has been associated with low birth weight and a variety of developmental problems. When a woman smokes, she is in effect taking drugs, and, like nutrients and oxygen, drugs cross to the fetus through the placenta. Any agent that can cause maldevelopment during the prenatal period is known as a teratogen. A number of drugs have been shown to be potentially harmful to the fetus. Excessive amounts of alcohol, for instance, have been shown to cause a condition known as fetal alcohol syndrome, or FAS, in children of chronic alcoholic mothers. FAS involves a distinctive constellation of symptoms: abnormal facial features, growth deficiencies, central nervous system disturbances, and mental retardation. One FAS child is shown here at birth, 8 months, and 4.5 years. He has consistently shown an IQ of 40 to 45. A comparison of the normal brain of a newborn with that of an FAS child who died at 5 days of age shows striking differences in size and in the pattern of grooves and fissures on the surface. The dangers of chronic alcohol abuse are manifest, but the effects of moderate to light drinking have not been demonstrated. Consequently, no one can say for sure what is a safe level of alcohol intake during pregnancy. Other drugs that are known or suspected teratogens include some prescription drugs, among them anticonvulsants, some antibiotics, and tranquilizers. Among the many over-the-counter preparations available, such as painkillers, antacids, and laxatives, some may have dangerous effects not yet clearly proven or detected. Not realizing this, many pregnant women continue to use over-the-counter remedies indiscriminately. Consequently, the Food and Drug Administration has recommended that manufacturers put warnings on all drug preparations advising pregnant women to consult a doctor before taking any medication.
The importance of caution in the use of drugs in pregnancy was underscored by the effects of the drug thalidomide. In the 1950s and 60s, in West Germany, England, and other countries, many women were given this drug early in pregnancy to ease discomforts such as sleeplessness and nausea, which are common in the first 3 months. Soon these countries were experiencing an epidemic of what is normally a very rare birth defect. Hundreds of children were born with rudimentary arms and legs, their hands and feet often only flipper-like protrusions. This disaster was traced to thalidomide. The drug seemed to stop cell division, particularly in the limbs. Taken between about the 27th and 40th days of pregnancy, when the long bones of the arms and legs are being established, the drug had literally nipped the developing limbs in the bud. The thalidomide disaster underscores a fundamental concept of embryology, the concept of critical periods. A critical period is a specific limited time during which a given development can occur. If, during that time, something disturbs that development, there will be no chance for correction. Proper development will never occur. Critical periods for different organs, parts, and systems occur throughout prenatal life. But the time of greatest overall vulnerability is the first 3 months, when all the systems and organs are being established. It is during this time that many teratogens have their most damaging effects. Besides some drugs, known teratogens also include certain disease organisms. These, too, often have effects linked with critical periods. Rubella virus, shown here, is one of the most dangerous disease organisms when contracted in early pregnancy. Rubella, or German measles, is most destructive during the first 3 months, when the virus attacks young tissue, resulting in defects such as deafness, heart defects, mental retardation, and cerebral palsy. Fortunately, a rubella vaccine was developed in 1964, and women of childbearing age can be immunized against the disease. But other infectious diseases continue to pose hazards. There is Toxoplasmosis, which is spread through raw or rare meat and the feces of cats, and cytomegalovirus, a virus of the herpes family. Other potentially dangerous infections include herpes simplex, syphilis, and hepatitis. Most infections, however, are not known to pose a risk during pregnancy.
We have looked at how the mother's body can affect prenatal development, at the mother's health, her diet, drugs she might take, and diseases she might contract. 2 other factors in the larger environment can also be mentioned: radiation and chemicals, such as pesticides and industrial wastes. Let's look first at radiation. Wide awareness of the effects of large doses of radiation on the unborn came with the bombing of Hiroshima and Nagasaki in 1945. Afterwards, an unusually high number of miscarriages, stillbirths, and births of defective babies occurred among pregnant women who had survived the blast. The precise effects of lower doses of radiation have not been established, but pregnant women are advised to avoid radiation, including routine X-rays if possible, in particular X-rays of the pelvic area. The exact effects of environmental pollutants are also hard to pinpoint, but in a few cases they have clearly inflicted damage. One such instance occurred in Minamata, Japan, a seacoast village dominated by a factory of the Chiso Corporation, a petrochemical company and maker of plastics. A byproduct of Chiso's manufacturing process was methyl mercury. Large quantities of this chemical were dumped daily into the waters of Minamata Bay. These were the traditional fishing grounds of Minamata fishermen, whose fish were the basis of the inhabitants' diet. The result of this pollution was an epidemic of mercury poisoning caused by eating mercury-laden fish. This girl, Tomoko, was born with a severe case of what came to be known as Minamata disease. Her body is twisted. She will never speak or walk. She seems not to know where or who she is. Not all chemicals have effects that are so clear and dramatic as those of mercury. Still, a pregnant woman should exercise caution regarding environmental chemicals, avoiding unnecessary exposure when she can. Genetic factors, drugs, diseases, other environmental elements. So many things can affect prenatal development. How is the pregnant woman to view her situation? Dr. Beverly Raff, Vice President for Professional Education of the March of Dimes, addresses this question.
We know so much about the different influences on prenatal development, and we're much more aware of certain dangers. This awareness is valuable. But it is also important to remember that most babies are born healthy and normal. It's easy to forget this if you become too preoccupied with the dangerous and abnormal. What can a pregnant woman do for herself and her baby? She can seek medical care early in pregnancy, eat well, avoid practices and substances that are known to be potentially harmful. And as much as possible, she should relax and enjoy her pregnancy. It's such a special, exciting time and the beginning of a special relationship with her child.
It is commonplace, yet extraordinary, the miracle of new life. Generation after generation, the miracle repeats itself, but it never becomes routine. In fact, Each repetition of pregnancy and birth seems to strengthen rather than dilute our sense of wonder. And the more we discover about the first months of life in the womb, the greater is our respect for the intricate process by which human life is formed.